Welcome to Ready and Resilient Now, Together Live, our new interactive series where experts and communities unite to build real-world preparedness for families and community leaders. Produced by the Force for Health Network in partnership with WADEM, this series connects you with actionable tools and trusted strategies. Today's 120-minute event includes two parts. Part 1, a special session with 17th U.S. Surgeon General Dr. Richard Carmona, exploring lessons from past crises and today's challenges. Part 2, practical steps you can take right now to strengthen your family, neighborhood, or organization. We want to hear from you. Share your questions and experiences in the chat. To dive deeper, comment from the platform you are watching this from, or better yet, download the 360-degree Force for Health Academy and join the Ready and Resilient community for more resources and tools. Now, let's meet our co-hosts.
Well, with all of that work done, I pressed the wrong button, darn it. Welcome to our second episode of Ready and Resilient Now. I am your co-host, Lucy Howell, co-founder of the Force for Health Network, joined by my co-founder, Dr. Robert Gillio, and of course, our partner in crime, WADEM, and the president of WADEM, Dr. Donahue. WADEM, for those of you that don't know, is standing for the World Association of Disaster and Emergency Medicine. So let me just fall on the sword here for a second. This is our second episode. We featured the 17th U.S. Surgeon General, Dr. Richard Carmona, in our first episode, and we are excited to bring our second featured guest, Dr. Evangeline Franklin, to the table here shortly. And but before we get started, you know, it's been 20 years since Hurricane Katrina. And when we were all discussing, you know, the editorial kind of topics and timeliness, it's September. So September is Preparedness Month, which is a perfect excuse to, you know, bring some challenges and some, you know, questions to our families. This show is really, you know, I'm a Main Street mama. And I surround myself with experts. And so the intention of the show is really to bring basic level health literacy knowledge with regards to preparedness and emergency disaster. Because oftentimes if something happens to you and you happen to be there, first responders won't get there. Maybe sometimes for 5 minutes, maybe 5 hours, and maybe, you know, as Dr. Franklin will come on later, you know, days later. So it is really up to us as citizens to be prepared. I'm ready and resilient now. So I open that up for conversation. And when we were talking about it, you guys reminded me, hey, this happened 20 years ago. And even though you were there, Dr. Gillio, on the ground, right? And Don, you had, you know, worked you've been decades into this space. You reminded me that most people that we might be talking to, like teens or young parents, might not even recognize the weight and the significance of this event 20 years later. Mm-hmm. So let's go ahead and set the foundation. You know, Rob, I hand it to you for opening remarks, and then we'll kind of lean in towards Don for the foundation of Hurricane Katrina. But a couple quick things. If you are watching this live, and that means that you're on YouTube or Facebook or LinkedIn, feel free. We set this up as an interactive chat and challenge. So you can go ahead and make a question or post a comment. And if we go ahead and bring it into the show, we will consider you a winner. And we'll grant you a free 360 ambassador membership at the Force for Health Network, which will give you access to kind of all kinds of tools and things. Our Force for Health Network is free to join, so you can go on to any of the QR codes that we will be showing throughout the show and at least download our app. But the ambassador membership will give kind of advanced tools, some wellness tools and things like that. So I just wanted to get that housekeeping out of the way for the good of the show. The first hour will focus on this fireside chat with Dr. Evangeline Franklin, again, Emergency Preparedness Director for the New Orleans Department of Health, you know, and I've already spoken to her, so I'm excited to bring some of these kind of key points up throughout the show. And then the second hour will actually be more practical and giving you guys challenges to, hey, how ready are you? Do you have a disaster readiness plan? If not, we've got some tools that we can walk you through at a macro level And then also we're going to take a look at family level. So because sometimes maybe it happens to be it happens to be Falls Prevention Month also. And so I've had a family member who's actually fallen, and it's caused a small, we'll look at the definition of disaster, but when it pushes resources for the entity of which is trying to respond, that could be defined as a disaster. So we're going to talk about some fall prevention, and then we're going to talk about readiness. Sorry, had to get all of that in, you guys. Rob, opening thoughts and comments.
It's been about 20 years since Hurricane Katrina. And I'm humbled by the people we're on with. You'll see they're professionals that work in the field. I wasn't, and I'm not. I was a dad sitting with my daughters watching television, seeing people on a roof with signs saying SOS, rescue me, I'm an American, help. And a daughter looked at me and said, Dad, we canoe and kayak. Let's just put the canoes on the roof of the car, go down and rescue some people. And to make a long story short, I got an invitation to do some help in Mississippi and then in New Orleans. And I was a well-meaning volunteer. And I learned a lot, primarily from our guest, Dr. Franklin. And we'll get into that conversation. So the role here of a skilled volunteer with teenage daughters in tow at times. Do we help or do we hurt the disaster? And are we more prepared now, 20 years later? I'd like to ask Don Donahue and Evangeline to answer sometime in this first hour. But thank you, Lucy.
Yeah, and so Don, help us set the stage in terms of the Hurricane Katrina and what type of event this meant in the disaster preparedness space.
Sure. And, as I'm sure everybody listening knows, Katrina wasn't the first hurricane to hit the United States. It certainly hasn't been the last. But it was a watershed event because of the scope, the scope of the storm itself, the particular part of the nation that it hit, and again, in the editorial discussions, I mean, New Orleans is a charming city. Most of it sits below the water table. So, it's prone to flooding like many other places. And it really revealed some of the shortcomings and some of the assumptions that we make, that, it won't happen to me, it'll happen to someplace else. Some of the lack of maintenance of our infrastructure, which is periodically a discussion in the news and in government, and it really shocked the nation. And there's been similar storms recently. Clearly, if you live in Western North Carolina, in and around Asheville, hurricane was not on your radar, but it was on the radar, and those people are still suffering. So, I mean, ultimately, to Rob's point, Dr. Gillio's point, I worked with a company that also worked in this field, obviously, and they had a great theme. They said their theme was every crisis is a human crisis. We can rebuild buildings. We can rebuild buildings. We can restore computer systems. We can find information. But the real damage is to people, individuals. Clearly, those who are injured or killed, sadly. But lives are disrupted. Communities are disrupted, and the frequency and the intensity of storms, for example, is increasing. Wildfires out west, wildfires all around the world, massive storms. In sharing with this, I had to remember the word when, again, planning this haboob. A massive dust storm. In Phoenix, you might as well have been in the Sahara. A threat to people there. So this is reality. This is nature's. I think this is nature's way of reminding us who's in charge, and it's prudent to be prepared, to know what to do, know where to go. And actually, this is a slide I did in a briefing from New Orleans, and as Rob said, a woman standing on top of her roof, damage in that. What's ironic about this slide is it's not from Hurricane Katrina. This was from Hurricane Betsy, which occurred when Lyndon Johnson was the president. I think it was in '68. So this is an illustration that nature's wrath is with us always, and we have to learn how to deal with that and how to respond.
Now, I have your whole presentation loaded. If there were any other images that or slides you wanted me to kind of pop to help kind of restate the
the next slide alludes to what I said. This actually came from the President of the United States. This is horrible. You could read it. I've never seen this. We will respond. All the red tape will be cut. Next slide, please. In 1965, in September. Arguably we're better than we were, but not as good as we should be. So it wasn't an unforeseen event when Hurricane Katrina hit. And Katrina, ironically, 20 years since Katrina, 24 years since 9/11, 24 years since the anthrax attacks, postal anthrax attacks. For many people, certainly my two younger children, it's a historical reference. It might as well be World War I. It's in the.
And I know that it's so easy to get through these time periods, and overcome already. But, I just want to bring a couple things up because of the amplification of maybe gaps here. And maybe Rob can transition into your part but bringing these up, what's your kind of final points on hurricane so we can move to Rob and then get Dr. Franklin up here.
You want to?
Yeah, I just wanted to know if you wanted to make a mention of these two kind of maps and
sure. That's actually my map. I'll step on Dr. Gillio's toes here.
Sure, map.
This is from the 2000 census income distribution in the city of New Orleans, Crescent City. The darker the coloring, the more income in that area. So you can see there's a large portion of the city to the right that is poor or near poor, working class, people who don't have a lot, of resources. Mm-hmm. Now here in 2006, 6 years later, this was the area that was flooded. And what this graphically illustrates is that disasters impact everybody, but they more significantly impact those of us who have less. Those of us who have fewer resources. Mm-hmm. And clearly our honored guest might speak to this. I'll set her up for that. When people are told you need to evacuate, but they don't own a car, now we have a problem. So, and these are the things that Dr. Gillio saw when he volunteered and went down there.
Yep. And Evangeline will Dr. Franklin will allude to it later, in terms of like, if nobody knows that you're only in a wheelchair and need help, then how can you be helped? So, Rob, thank you for setting that foundation, Rob, and then we get a little bit tighter. I've got a couple pictures that, you sent over if you wanted to walk through and talk through, and then we'll get
I came down. I was encouraged to come down after we set up a clinic at Ground Zero 4 years earlier, and Surgeon General's office knew what we're up to. And the last one you saw, the water level. And the point I'm making here is the medical records, mostly on paper, were pretty much destroyed for everyone in the flooded zones. So you'd see someone and they'd say, oh, I take 2 little white pills and a pink pill. And again, Dr. Franklin can speak more to anything. Go to the next shot. This happens to be Dr. Franklin's destroyed house. where we were discussing what we can do next. She involved me in the clinic that she and her department of special projects at the health department set up at the zoo. I was a well-meaning volunteer, but I was also sensitive to the care that the caregivers need. Along those lines, this is some work in Mississippi, which didn't get any news, but had a 23-foot storm surge that destroyed Long Beach and Pass Christian. And this is a volunteer effort. When FEMA threw up its arms and gave up, circus tents were set up by volunteers from around the country. They happen to be my daughter serving a Vietnamese fisherman, but this is in Mississippi. Next slide. And I see the picture lined up there with the outdoor surgery one. Lucy?
Yeah, sorry.
Okay. But
and then the last one was really kind of like,
and this was at the clinic that Dr. Franklin had set up at the Audubon Zoo that I was a small part of. I showed up with my stethoscope, a backpack, and a big vehicle thinking people could use some help. And I helped out for a while there. And then in that flooded area to the east that you just showed, Don, we did another event, which I was much more involved with planning in Joe Brown Park and got the Mayo Clinic involved. But we shouldn't be talking with me anymore. The expert is here, the person who taught me more about emergency preparedness and response than anyone, and also about social determinants of health, rich and poor, and how it all does. That's Dr. Evangeline Franklin. I'm proud to say as a colleague of mine and a friend. Hello, Dr. Franklin.
Hi there.
We'll call you. Welcome.
And yes, we are very dear friends. Rob helped me empty my house out because it was destroyed. My parents' house was destroyed. And all of that happened while I was in the Superdome taking care of patients in the special needs shelter. You see my dog behind me. I have PTSD, so my dog is part of my treatment for the PTSD that I suffered as a result of my experience. And unlike many people, Rob says he came into this as a volunteer with his experience at 9/11. Frankly, that was more experience. His experience was more than any training that I got before the storm. I had been at the health department for just under a year. The storm came, and that is when I was inundated with the experience of being a disaster manager. So I learned on the job. And one of the reasons why I teach a course at the University of Baltimore on emergency preparedness and management is to help individuals in the public affairs school learn about what it is that they need to know when their institutions become involved in a disaster. Don has been very, very clear about the extent of disasters in this country. And I have a few slides to kind of tell you exactly what it is I learned. So it's a mini course to show you that you are capable of being prepared. If you are a teacher or if you are a department member or a supervisor, you are not only responsible for yourself and your family and your extended family, but you are responsible for your employees, because your employees are going to need some guidance in getting themselves together in order to be prepared for whatever may come. If you have been a caregiver, which was also part of my life experience, I took care of my parents after Katrina full time before they passed away. I was very sensitive to the fact that I had 80-year-old people that I was needing to evacuate from a high-rise apartment if in fact something happened. So I had to make sure that we were organized not just on a daily basis, but we were also organized in case we had to flee. One point that is very clear from Don's slides is that if you've got money, you can leave. You can get on a plane, you can get on a train, you can leave. That's if you have money and you also have the inclination and the instinct to follow the evacuation order. That is one of the most critical pieces to this, is what do you do with people who can't flee? And there's lots of them. And there's lots of different reasons why. And one may be that you can't take your dog with you. You can't take your cat with you. And you may not even understand what your life is as it is in a quiet period of time without all of the pressure of having to pack yourself up and leave. You might not even understand what's going on with your own health. There's so many people that I, as a physician, and probably Rob as a physician, have spoken to about whatever their medications might be and their illnesses might be, and they are clueless. They really need to have support, counseling, etc. Now, in my experience, so I'm in the Superdome, I get evacuated with my staff. We go to Dallas, Texas, work in a shelter. So I've worked in a shelter to help New Orleanians actually get the coaching that they needed to get the services that were necessary and to help them understand their medications and their illnesses. Then I returned to New Orleans after managing a staff to actually assist in a shelter. And I was involved in recovery and with preparedness. So I was the lead on developing an outreach program to many people in those poor areas who were housebound and had absolutely no assistance that they could count on being evacuated. Not only did they have no assistance, but they really had no knowledge as to what was available for them. Fortunately, in New Orleans, Amtrak was involved in most of the evacuation plans during my tenure. And what Amtrak did is they loaded folks on the train and they took them upriver. And that's a really important piece in a community that you have to develop responses to folks who really don't have resources and folks that really don't understand what is going on. Now, I have a few slides of my own because I teach this stuff. And one of the things that's really important to me is to make sure that those folks who are leaders, every one of you who I'm speaking to, are prepared with the tools not only to take care of themselves, but their children and their husbands and their wives and their sisters and their brothers and their aunts and their uncles and the old people in their family, and also understand that they are responsible for the people who they supervise and their extended relationships. I've worked with churches. I've worked with councils on aging. I've done individual counseling because I did that when I was in Dallas. And the individual counseling on the telephone in the outreach program to get folks registered for the evacuation services which would be provided to those people who did not have resources. Then after that, Rob alluded to the clinic. People did return to a city that had been dewatered. So the levees had broken. The city was flooded. The levees needed to be repaired and pumps need to be put in the water in order to get rid of the water that was there so people could return to take care of their stuff. And I want to tell you, I have accumulated now a ton of stuff, but hey, it's just stuff. But it's a difficult realization when you get to your house, open the door, and it smells like mold. and everything's wet. And you have to, Rob showed the picture of the floor of my house with the drywall removed. It's really, that was really one of my more desperate times. I don't know what I would have done if Rob hadn't been there. Even just to try to organize my thoughts, because I was learning all this stuff on the job. So the few slides that I'm going to show you is just an introduction to what it is in the community your role might be, in your family, what your role might be. So let me try to do this. And
yeah, sure. And while you're doing that, I'm going to bring up one quick thing, because Dawn said it best on the first episode, right? Nobody needs disaster medicine until you do. And so really, this is such a crux of what it is that we are trying to do here. And we're speaking to the family leaders. We're speaking to the school leaders. We're speaking to even the county administrators. You may not have certain knowledge bases so that you can quickly make quick decisions on that. Now, Rob, he said, hey, not a trained first responder, then step up and be a second responder and care for the responders, for their families and the victims. So again, just kind of reminding a couple of us, and then Dr. Franklin let us know you should just be able to share screen and then choose the screen and bring it up to the stage.
Okie dokie. I'm going to do this.
Okay.
Lucy's the expert. So I should share screen. I just do share screen share with two monitors. Okay, got rid of that. Share screen. Now it's asking me to pick a tab.
Okay, perfect. So your tab that's open showing your presentation should be right there. And you can just click.
Oh yeah, there is that it?
And then
It might be, but you're not sharing yet.
You're looking. I have that problem. It's hard to see with the tab what's on the slide.
No, it is hard. I'm just gonna respond to something Lucy said just briefly. The role as a second responder is not just to someone who's lost their home or their relative. I'm thinking specifically the caregivers, the school counselors and nurses that are helping the kids adjust, the ministers, the social workers, the psychiatrists that are seeing people, the people working in the hospital, the fire department, police department, National Guard, they and their families, their children, even if you're not at the disaster, even if you're in Boise, Idaho, but someone's down there at the disaster or they're fighting a fire, it's scary to have your spouse or your child in harm's way. I couldn't breathe for 2 years while one of my daughters was in Afghanistan. Couldn't stand it, couldn't watch the news. I needed all the support I could get emotionally. I wasn't even there. I didn't even know what was going on, but I saw on the news bad things. So being a second responder is a easier thing to do. Just being kind and listening and making sure you can run an errand. You can, even a neighbor, like when Vanjie, after her parents lost her house, she moved them to Baltimore. She moved up to take care of them. And just even offering, like, can I run to the drugstore for you and pick up a prescription, is being a secondary responder.
I know, that's why I brought that up, so we can kind of remind folks, so Dr. Franklin, I do see your screen in the back. And so if you want to go full screen on that, I will add it to the stage and then you'll be able to go.
All right, I'm full screen.
Let's see. I'm going to add this to the stage like this.
I see it.
Which does not look like we can go. I'm going to maybe remove it. Oh, just go ahead and click the bottom screen. So the very projector at the very bottom, you've got next to the slider. We should be able to take that up. So along right there on the slider, right? There's a slider on the bottom right, and then right to the left of that, there's a little.
Looks like a movie screen.
projector screen.
Oh, it looks okay. I've got a projector.
Yeah.
Oh,
They're down there, down where you just were, Evangeline, at the very bottom.
Right.
can you see it now?
No, it might be on a different screen. We're seeing it.
Okay, well, can you see the whole slide?
No. Take that slider at the very bottom of your, what you're looking at here, and just slide it to the right. Go to the bottom, slide that, see what happens.
Yeah.
Oh, crap.
No, yeah, but the little projection screen that's right to the left of the slider, right to the left, click on the projection screen, right there.
Yeah, see what happens.
Where's this slideshow?
Try it, see what happens.
Yeah.
There you go.
It's on a different screen or monitor. You're not in the right. It's opening up in a new monitor, in a new screen, in a new tab.
Can you read it?
You can.
I can read it to you.
We can only see half of it. We can. You can email it to me, and I can share it if we want to just keep on with the conversation. That should take it. Maybe go under File, top right, top left, File, and maybe Present. Does it give you an opportunity to? Oh no.
Nope.
Interesting. Sorry about
Well,
that.
you know what? I will just
click that. Then make it bigger. You're sharing a square screen here.
Oops.
I don't know what this white thing is. I can't get rid of it.
I know.
Let's.
So if
wait a minute.
There you go. Good enough, Angie. Start your presentation.
Okay.
And then go ahead and take the slider down a little bit so that we can see the whole slide. At least that'll get it. Oh, no. Okay. You can move that up. That is the whole slide. Never mind.
Okay. All right. This is not complicated.
Go ahead. We're listening. All ears.
Yeah. Okay. Technology. One of the reasons why I picked this particular background is this network. Okay. The network idea is key to understanding what community is all about. And when we talk about emergency preparedness in the United States, it's got to be whole of community. That means everybody. The National Preparedness Goal is a document from Homeland Security that indicates that we need to be secure and resilient as a nation with the capabilities across the whole spectrum of the community to prevent, protect against, then mitigate, respond to, and then recover, and then go back and do it again.
I wonder if I take this tiny little break, and if you go up to slideshow in the menu, right, where it says slide along the menu.
On the top, go up a little higher.
A little bit higher. It's in the menu. You're almost there. Slide.
Okay, wait a minute. I want to turn my phone off. I apologize for that.
Now you're part of the community.
Click on that, and then from the beginning. So click from the beginning. Perfect. Click on that, and then we should be.
Can you see it?
So interesting that it doesn't go.
Yes. Okay. Let's just go back to the other thing.
Yeah.
Because it's taking too much time. Okay. This list is very important because it talks about the natural, the technological, and the human-caused disasters that we are exposed to all the time, and we don't know it. Okay? We just went through a big pandemic, but that could have occurred with a mine accident, with a chemical attack, with utility disruption, with a tornado, a tsunami, and wildfires. And if you pay attention to the news at any point in time, you'll find that there are plenty of disasters. Preparedness and planning and management is a similar worldwide activity, and it is connected worldwide, which is why Don's organization says world in it. The language is similar. The communication is ongoing 24/7, actually, just so that you can understand that you have a system around you. The requirements for successful execution is education, planning, and exercise. So right now we're talking about how do we educate ourselves to use our daily tools and activities to apply to emergency preparedness. But there is a local system, a state system, a federal system, and an international system that provides services worldwide. So we actually have a search and rescue team in FEMA that are actually two of them that actually responded to earthquakes in Turkey. And they are specially trained in order to deal with search and rescue. This component talks about the National Preparedness System. I will definitely share this with you guys permanently because it is very helpful. And it talks about all of the things we just said, or I just talked about in terms of the cycle of a disaster. So I'm going to give you some photos just so that you can see that this is something that happens all the time. You can be in a car accident. You can be in a train accident. You can slide off the road in the snow. You can have first responders. As you can see here, we have firemen who are cutting a victim out of a car. I have lots of rail accidents in there because the photos are easy to find. But imagine being in a hurricane and then having a rail accident, which would not be unheard of near New Orleans, and then have a chemical exposure situation. Let's see. I like trains, don't I?
Mm-hmm.
And I love firemen because they're very talented. One of the things that we definitely understand in terms of search and rescue is that we may need a helicopter to get us out of our disaster. And that's something that we don't think about. If you live in an urban setting, you have a lot of resources available to you. You've got 911, you've got first responders that can take you to a hospital if in fact you need them. And that's something that we depend on. We don't even think about it, but that is part of a preparedness plan and an emergency operations system. Here we get into some things that are different. This is from a mass casualty event where a shooter has killed a bunch of people, and you have the remnants of what happened afterwards. This is a picture of the Boston Marathon bombing. So you can see that as a citizen, you can be easily involved in a disaster just by walking down the street. And here are my trains again. Let's see. This is a tornado. You can see where there's just nothing left in this particular part of the community, and your first responders are trying to help people get back to whatever it is that's left. And wherever you live and wherever you go, you are at risk of something. It's important to be aware, even when you travel, that you may be at risk. One of the things that happened when I was in the Superdome is that the hotels had been sheltering individuals who decided that they didn't want to evacuate because they wanted to have a hurricane party. Okay, so these are visitors. The visitors ended up in the Superdome with me, having no idea that what they might experience could be a major disaster. I've got really interesting stories about that part of my experience.
Adults.
I'm sorry, there's an audio thing that happened here.
They ran.
I muted you, no problem.
I wanted to show this slide just to let you know about the Department of Defense capabilities in terms of evacuating people who are sick. This is an airplane. And these are paramedics, nurses who are taking care of patients. And as you can see, or maybe you can't, but I want to point out, is that you've got stretchers with people that are really stacked on top of each other. So this is a part of the system that's really critical. Search and rescue, we have animals involved, and those animals need particular care. And then I want to sort of spend a little time with the COVID pandemic. This was a terrible experience worldwide. We've got to remember that this was a worldwide experience, but our individual experiences are what add up to what the damage was worldwide. And vaccination, we had to come up with a vaccine, brand new vaccine that actually helped to save lives, but many people died in the interim. I spent a lot of time looking at the history of the development of vaccines in the history of medicine. And it's a fascinating experience to see what some of those historical events are and what it is that we did to extend the life of people. So don't be afraid of your vaccines. Don't listen to anyone who is a vaccine denier. Make sure you get your COVID shot before they run out of the vaccine, because the Trump administration appears to not even want to prepare or support the preparation of the vaccine and distribution of the vaccine. And furthermore, Don brought up what was going on after Hurricane Helene in North Carolina. That was 2 years ago, I believe. Is that right, Don?
Yes, ma'am.
Okay, so they have just now, released funds to help those individuals. That is a shame. And it was billions of dollars of loss, but there's only $60 million that's being provided by FEMA to pay for cleanup and restoration of public buildings, and very small contributions to individuals who lost their homes. So when we talk about a disaster, it is totally encompassing. Okay, so now I'm going to get rid of this thing so you can see me because I'm all animated and stuff. Okay, it's totally encompassing. I could not get into my bank account because the banking system did not have ATM type of service. I could not use my cell phone to call anybody because of the way that the cell towers were organized. I could not inform my parents, nor could they inform me of what was going on with them. Fortunately, they were on a cruise ship in Greenland. Okay. I couldn't bring my dogs into the Superdome, so I lost them. They passed away. And the consequences of an experience like this on the individual as a victim need critical assessment and intervention. I myself have post-traumatic stress disorder, which I have suffered from since Katrina, which includes the use of medication and psychotherapy. And that's why I got a dog. See the dog? And this is my fourth dog, Rob. You met Frankie.
And what I was, and you are an expert and a leader in that space, right? I bring up this, this whole lessons learned, right? If we were to be able to, and now just to restate, you co-wrote this book called Lessons Learned with Rob Gillio, who is it's basically, I think 12 or 13 stories of personal stories so that we can kind of pull out and learn from. You mentioned something like yesterday when we were talking about, Amtrak, and you can think that you're prepared, you're the emergency preparedness director, you had these partnerships, you had these plans, and yet when SHIT hits the fan.
Oh boy, you really said it, girl.
Okay. Sometimes those plans go. So talk about, even like the Amtrak issue, perhaps.
Okay. So the Amtrak issue, it's important to understand that the private sector needs to participate in not only recovery, planning and recovery for what it is that they do, but they also need to participate in the community because they take your money. They provide a service to you. So the Amtrak piece was key in helping that group of people who were in the space that was on Don's map that was all light colored, meaning the people who were the poorest, to get them out of town. And so that meant that I had to sit down with Amtrak and work through the logistics of what it would mean to get people to the station. And that in and of itself is not easy. So we had to involve lift buses to provide transportation. We had to organize family members around getting people who were who had medical issues. If you have an elderly or a sick relative who is in a nursing home, that is a particular part of the planning that needs to happen. Now, every single one of you can Google emergency management department for your city, and there will be a plan that you can read. Every single one of you can Google for your state the plan, which you can read. Okay. You can also get federal information. If you remember the slide that had the little book on it, I have so many PDFs of FEMA documents and Homeland Security documents that support state and local officials for developing their plan and also providing assistance if, in fact, the resources of the community in which you live cannot address the issue. It's not hard to see that a car accident will attract the police. Okay, you go on your phone, you do 911. It's not even hard to imagine a fire response to a rail accident or a plane accident. That's not hard to imagine for us as citizens. What's harder to imagine is when your neighborhood is gone. You've lost your animals. Your family has evacuated to who knows where. Okay, because if you have a family evacuation, you may be able to go to a relative's house. If you don't have a family evacuation plan, you go to a shelter. Okay, you got to understand that shelters are critically important, not only for the evacuation piece, but also for caring for people who have lost everything. So the shelter I was in had medical services, social services, mental health services that were provided by the state of Texas because it was coordinated and went up with the American Red Cross. It went up over the period of days, but let me tell you, it went up. And now we know that we have to have those systems in place. We have to evaluate what we did. We have to change whatever it is that we need in terms of process and the supplies and the talent and the expertise that needs to be applied to a particular situation. And all of this means that we've got to communicate. And communication can be very challenging. You know, sometimes one of my problems as someone who suffers from PTSD, you can't tell now because I'm all animated, is that I have a difficult time with people. I don't like large crowds. Imagine me having to work in a shelter at this point in time in my life. After that experience, I would have to really gear up in order to do it. But I am totally wedded to teaching people, totally wedded to supporting individuals who need guidance, need tools, need anything to understand what it is they should do to be prepared, how they can use the skill of writing a grocery list, which we all do when we go shopping, to use that skill to make the list of things that you need to put in the bag when you go, your go bag. The things that you need to do to put in your box, in your tornado shelter, in your home, building a tornado shelter in your home. You know, my life now is completely digital. And that is because when I leave, I take my computer I take my brain, I take my dog, I get in my car and I go.
I'm curious, if you were to look back and like, what would, and Rob, I know you have a question. My quick question is, what would you tell yourself from 20 years ago? Like, so you've got all this wisdom now, and if you could go back to coaching, Dr. Franklin 20 years ago to be more ready, is there something that comes up? I wish I would have done this, or what is that one thing?
I should have taken my dogs, even though the shelter didn't allow dogs because they died. I was a very big loss. What should I have done?
As a preparedness director, is there something that comes out and say like,
well, I'm gonna give you an observation, okay?
Mm-hmm.
When I was in the health department, there was no emergency preparedness director in the health department. I was actually the director of clinical services. I was in charge of clinics, and I had 7 clinics that I was running with paper records. So I was trying to install an electronic system in order to avoid the loss of the information we needed on our patients. Those clinics ended up getting flooded. Okay. So my response to that was to figure out a solution that worked. And my department director, Dr. Kevin Stevens, was approached by a number of volunteer provider groups to set up a clinic. And I was the project manager for that. We took over the Audubon Zoo. Okay. Those of you who may or may not know New Orleans, the Audubon Zoo has a huge footprint, and elephants and lions and tigers and bears and monkeys and stuff. And in the public spaces, we set up clinics, we set up eye exams because you can lose your eyeglasses in a situation where you have to flee. We also had dental care for people who were there, and we provided over 10,000 services, including providing medications to those people who had lost their medication. What I can say as an observation is that we were not prepared. But we learned a lot, and we had a significant group of talented individuals who could think on their feet. And that's the other part of being prepared. And Lucy mentioned it, is that, that there's one thing where you put up the plan and you rehearse the plan and you do all that stuff. There was a plan before Katrina that was rehearsed. I was not a part of the rehearsal. The plan was insufficient. So we learned from the fact that that plan was insufficient. And when you are in the space of having to flee or prepare to actually flee, or have a car accident, or be in the middle of a shooting. Think of what happened in Las Vegas with that shooting in the concert from a hotel window. You go dark. You go dark, but your preparedness will teach you how to get back and through that particular dark space so that you can react, so that you can decide. Some of the people in that shooting in Las Vegas at the concert goers became first responders. They went back out there into that space where the shooter was targeting individuals, and they risked their lives to help rescue individuals who were still out there.
That's what Rob had mentioned yesterday. It's like, not only do you need to know the knowledge, you actually have to have the confidence and the grit and desire to act. It's like this multiple. Rob, I know you've been chomping at the bit, but listening patiently. Go ahead. Oops.
Rob.
My bad.
No, I was muted. Lucy knows that the only way to have a guest talk without me interrupting is to mute me. But I want to point something out here. The title of this is Ready and Resilient Now. There's ready And then with the last few things you were talking about is resilient. And I want to comment on 2 or 3 things you said, just as briefly as possible. One, you left the Superdome and you were evacuated to a shelter in Texas where you worked your butt off. You know what, though? Then you came back, and you could have easily gone dark, gone in the diaspora to anywhere else in the country to get away from it. But what did you do? You called Kevin and said, how can I help? And he said, Vanjie, set up a clinic. We got thousands of people that don't have medicines, don't have glasses, don't have dentures, don't have medicines. So you came back in the midst of your mental health crisis, and you got to work, and you recruited volunteers from across the country, including, I think, a couple doctors from Cuba, for that matter. And you set up a clinic in the park, and I'm just in the zoo, and I'm glad to be a part of that. But you set that up. Just the image that struck me is the alligator house was dark. And so we put all the slit lamp things. You didn't have to dilate people's eyes. It was dark. And then when you got done, you went behind the alligator house, and there were volunteers making eyeglasses on the spot.
On the spot.
People didn't have their eyeglasses for 6 months. And then they got it at Health Recovery Week, thanks to you. Then they opened a school where Mr. Josh Williams worked. And I think you introduced me to that school. We went and started talking to those middle school kids, and you were part of something called Project Safe. I don't have that video with me live right now, but you were part of Project Safe, where Josh and I, with your guidance, created a disaster plan that middle school kids used with their families. 90% of those kids were in the shelter or on rooftops. Then they put a disaster plan together. They were resilient enough to put a disaster plan together, a go kit, the works, a railing point, and all these other things where the family got together. And when Hurricane Rita came along, only 5% instead of 80 or 90% ended up in the shelter. The rest evacuated. One thing I'd like you to, so that's the resilience, even if that's what taught me that a health literate teenager can stabilize a family.
Absolutely.
All right. And then one last thing I want you to comment on before we kind of get done about this conversation. Implicit racism, or maybe explicit racism, entered into the evacuation. Josh tells me of people that crossed the bridge and couldn't get into the next parish. Kevin Stevens told me about an Amtrak train where people weren't allowed to get off in the city where it stopped. They didn't want all these poor Black folks in their city as refugees. Did you experience anything like that? Are my observations exaggerated from the stories people told me?
I only know those things by report.
Okay.
I did not actually see what happened with the folks that came from Gretna, but it's not inconceivable, or the folks actually trying to go to Gretna. It's not inconceivable to me, especially in this particular climate where it is very explicit that we all don't agree that we are equal members of a community, regardless of what we look like, regardless of who we love or how much money we have. Because if you take a look at that, the group of the poorest, the people who are poorest, it's kind of amazing what part of the community that they might be contributing to. Many of them work in restaurants. Many of them work in hotels. If you look at the folks who I took care of at the clinics that I was directing, some of those people had jobs, but they had jobs that were so poor, so little income, that they could not afford to go anyplace else but to our clinics. That's a tough question, which gives me.
Okay. All right. It's something that right now, where you have people very angry about, let's say, a recent assassination or a shooting at a university, or for that matter, a grade school or a church. We're all potential victims, rich or poor, Republican or Democrat, independent, immigrant, or daughters of the American Revolution. Stuff happens. We all need to be prepared, and we all need to be prepared to help others. We need to be resilient. Now, Don's done his work all around the world.
All around the world.
Not just at Ground Zero, not just at Katrina. Any thoughts or reactions, Don? Get into this. You're on mute also.
So, much like Dr. Franklin, I have to think about it. You're absolutely correct in that. You're absolutely correct. As I said at the very beginning of this session, the disaster is the ultimate equal opportunity event. Dr. Franklin talked about the pandemic. COVID-19 didn't care if you were a billionaire or you were or homeless or unhoused. If you got it, you especially in the early days, many people died lonely, sad deaths. So the sense of community, the sense that everybody contribute. Most people contribute something to a community. You've probably heard when I teach my students, I talk or when I interview, people talk about teamwork, and in many cases, I think we tend to pay lip service to teamwork. And my analogy is football season's back again. When in a football game, last minute touchdown, the quarterback, the running back, the receiver who gets celebrated. But if those anonymous, nameless linemen decide, I don't feel like exerting myself today, the star quarterback, running back, receiver is going to have a long, painful day. And one of the measures, it's funny, Dr. Franklin probably is well aware of this. Historically, one of the measures that FEMA uses, especially in the Deep South, to measure whether a community is rebounding and is resilience is showing, is whether the Waffle House opens up.
Oh yeah,
and that seems inane, but it's true because the Waffle House, the grocery store, I've seen
Walmart.
I've seen stories on the news, including just recently, the local high school football team being able to go out and play their rival from across town or from across the state. All of those are the little things that make us human, make us humanity, and make us a community. So, the coming together and to taking care of each other. Rob, you've gone down you went down sort of a path that I don't know that I would have gone down, but because it's September, because it's anniversaries, I remember 2001, post 9/11, people opened doors for each other. We cared about each other. We all were Americans. We all had empathy. I'm not sure where that all went, but we need to find that, especially with raw feelings, raw nerves, strong emotions. Strong emotions are fine, but we need to get along.
We need to get along, and we need to be self-reliant and take personal responsibility that I'm ready. I've got my meds. I've got my go kit. I've got knowledge of what to do. Dr. Franklin, you mentioned the Las Vegas shootings, and I'll show you a picture from Boston Marathon here in a second, if I could. But the ability to know what to do is so important as we look going forward. And I'm not going to be political, but I think what may be happening is that some people will lose their healthcare coverage. Some people will lose access to healthy food. Some kids might lose access to school lunches. Some people don't have access to certain healthcare things in women's health. And the point I'm getting at is you got to know what you can do to help yourself. Tell the first responder or even the medical system can catch up with you. With the Las Vegas shootings, that I heard a story in talking with one of the first responders that I did in an interview, and that responder happened to, doesn't matter, too long a story, but talked about someone talking about they cradled someone in their arms who was with them. Don't leave me, don't lose it, don't leave me, don't close your eyes, stay awake, as they bled out of a wound in their distal, their forearm, and bled out. And when the patient became unconscious, they started CPR. If there's no water in the hose, you can't turn on the sprinkler. There's no water pressure. So not knowing what to do, where someone else put on a tourniquet, a program called Stop the Bleed, something we teach in Force for Health, is critical. It's everything on TV is all, the only first aid you ever see is CPR. But the point is the health literacy of when you're in a crowd and stuff happens, someone collapsed on the basketball court, can use an AED. That's a disaster.
That's a disaster.
Yeah, for that person, that family, and then traumatically for everyone who sees it, that's a disaster. When someone falls, getting out of the bathtub, breaks their hip, and then they're dead 2 months later from that blood clot or from the stroke a month later because they hit their head hard, that's a disaster. And so the ability to prevent, prepare, respond, and recover. You are an expert at recovery. You're an expert at all this, Dr. Franklin, but your remarkable recovery, short-term to set up the clinic, not just at the zoo, but then to work with me and others like at Mayo Clinic to set up the second clinic in Joe Brown Park. Short-term is good, but then long-term, many people have avoided this topic in their recovery. Many people, if you're involved in a school shooting, it might be hard to go back and be a teacher. Mm-hmm. But you are teaching this stuff and reliving it every day. I remember a time when I was with you and it started raining and you had a panic attack. I'd never seen it before. It was just strange. I also remember walking your dog and running into Emeril Lagasse, who came out of his restaurant. He saw me at the window. Emeril, this famous chef at the time. I don't know if you people watching this remember it, but I'm standing there. I look in the window of Emeril Lagasse's restaurant. He makes eye contact with me and he comes out to talk to me. I thought, I'm going to talk to a celebrity here in New Orleans as part of the benefit of being a volunteer. And he comes out and yells at me because your dog was peeing on his window. He had lifted his leg. And he said, get your out of here. So anyways, that was the highlight of my New Orleans experience and probably the most difficult part I had. But I was inspired, and I think others should be inspired by people like you and others that have to go back and teach in a school. Go back and go to college right now. Mm-hmm. What success, and this is where, look at the title of the book, Success is Achieved. So these are stories that are available, for the in Force for Health. This is all laid out, but these are stories from normal people, people like Kevin Stevens, who ran the health department, of what good came out of the disaster. And I think that's an important thing. When you hear lessons learned in your military, your police, your fire, it's like a morbidity mortality conference. Why did this patient die? What did we do wrong?
Yeah, what did we do to screw up?
All right, that's one level. And I want people to think, what can we get out of this? We were given a ton of lemons. What lemonade? What can we learn? Moms and dads, when you send your kid back to college right now, you got to be scared to death.
Yeah, I believe that there was recently a lynching of a Black student at an HBCU.
Two.
Okay, see,
Two
so
in the last 24 hours, and the default answer is no foul play suspected, right? That's a whole kind of separate type of.
Yeah, that's a step. But that is you have to remember that the people in a community have different feelings, different prejudices, different perceptions of other members of the community. When you are a disaster planner or when you are planning, you have to get confident enough to be able to deal with the system as aggressively as you need to wake them up, to get what it is you need. And I learned that from, believe it or not, from taking care of 80-year-olds. who went to the hospital, 80-year-olds who hospitalists, the doctors in hospitals really don't care about, let's face it. And I had to be their advocate. See, so what happens is that the advocacy of every person needs to blossom in terms of developing a plan and being confident in that plan and the response that needs to happen at the time. You can see I'm very enthusiastic about this.
And it's a good segue. I've been a terrible timekeeper because we're like a quarter into
I could listen to Dr. Franklin all day. So
already.
Don't worry about it.
But it's a perfect segue and reminds us why we're doing this, right? At the core of preparedness is within the home and the parents and the family structure. And so, again, representing the perfectly imperfect mainstream mama here. Okay. I just want to know, am I doing everything that I need to do to be prepared? For example, we work very closely with the Red Cross down here. Love Courtney Sloniker, who's the executive director of the Arizona Red Cross. She used to serve on the Pima County Tucson Women's Commission with me, and she even coached my daughter in basketball. I mean, that's how close, when we talk community, we talk about the people that are at the forefront of like responding, to know your network of doers is just one challenge. So as we come together and really focus on this Fit Family Force launch, which is very exciting. We'll have some launch on this later this month. And then October, we're going to be good to go. One of the very first things that we want to challenge parents on, okay? Primary audience, parents and teens who want to be a better ambassador for themselves and for others. But secondary audience for this broadcast is really, like we said, the business leaders, the community leaders, the school district leaders, so that we can help spread this message of preparedness, right? Rob, you always say, we want to help teens thrive in ordinary times so they can survive in extraordinary times. I think that was like really coming out of Katrina, seeing the results of, holy cow, these kids didn't know how to swim, or like they're just access to water. It's just all these different things, right? So I'm just trying to make a segue into part 2, which is really the importance of disaster planning. Now, at the Force for Health, there is a badge that you can actually earn and earn coins if you were to sign up for a free membership and do this. It will take about 8 to 10 minutes. And we can, if I just looked at this quickly and share the screen, there is, where take this, remove out, and then I'll just take this kind of up. So our challenge to families in the next 30 days will be to create your own personal disaster plan. This has the check mark, seal of approval from WADEM. And when you're done with this, you'll actually get a downloadable PDF, right? That if you want to have hard copy and you'll be able to check through, do we have our Go Kit ready? Is grandma's, transportation all set up? Do we have a primary place to meet? And if that primary place to meet is not accessible, do we have a second? Have I shared it with my family? So I'm just setting the groundwork for Rob, this next conversation about the disaster recovery plan. So how can we prep moms and dads and teens that care?
Let me toss something in before Rob engages. And something that Dr. Franklin said, one of the things I've done, courtesy of my younger son, is I've worked with the community that has the community of students that has learning differences. And my son attended, he did well, graduated from college, proud of him. But he went to a special school, and they teach skills to deal with your learning differences. But the biggest thing they teach is self-advocacy, to take care of yourself. And so as I was waiting for this segue, you do not have to write a plan for a county or parish. You don't have to be a professional planner. You don't have to become an EMT. You don't have to become a volunteer firefighter. Wonderful if you do. I'm the only one in my entire family for 5 generations who's never been a firefighter. But you have to have a plan. And I was trying to remember if I said this last month or I said this in one of our conversations. You have to have a plan. On 9/11, there were 4 people in my household. I was in the Pentagon. My daughter was in school in Georgetown, grade school. My son was at Lincoln Park on Capitol Hill with the nanny, and their mother was working at a hospital in northeast DC, all within a 10-mile radius. But all 4 of us were in a different spot. There was no phone communications. Obviously, my ex-mom knew that something was going on. She worked in a hospital. They got notice. So where do you go? Where do you reunite? What are your options? What are your plans? So it's a matter of having a plan. I mean, we finally connected at about 1:30. That was the first time the phone would work. And I got it by walking across the street into an apartment building and said, "Can I use your landline?" So, it's the simple things. Have a plan, know where you would go, know what you need to bring with you. Know the important things. Have in a wildfire or tornado, you're probably not going to have, you're not going to stop to take your medicines. But if you have a list of what your medicines are,
right,
you can get them replaced. And that's what happened, as Rob said, that's what happened in New Orleans. The people lost their meds, the pharmacies lost, they either had paper records, which were destroyed, or they had electronic records, and computers don't work well underwater. So have a plan, know what you're going to do. Odds are you will not be prepared for every single disaster that may befall you, but you can be prepared for most of them, and you can survive them or survive them better if you have a plan. I keep beating that theme.
But I think self-advocacy is so important. You bring up a good point there with that. And I think it's a planning. There's one thing, and I'd strongly encourage everyone, get our plan, download it, make it. Have your kids have it, send it to people at college. Maybe your boss wants to share it with people at work as an individual. But even before, so the formal planning is great for a bigger type of crisis, but there's a mindset of being aware, just what's called, some people call situational awareness. If you're in New Orleans and you're in the Garden District, you're 8 feet below sea level and 9 feet below the levee wall. All right. So you better know how to swim or how to get the hell out of there quickly. But the point is, be aware if there's a backpack, potential bomb. Be aware, then that I know something, I should act. And then share that information with someone if you need to, like the security person at the airport when there's just a backpack there. Be aware, care, share, and then prepare. Have a plan. You're in a movie theater. You're at a lecture. If you're in class right now watching this, where's the exit? If there's a fire, if there's a bad guy, where could I hide? And if my teacher falls over with clutching his chest, where's the AED? Those kind of simple things. It's not a big disaster plan that takes maybe 10 minutes to do. But it's a mindset of always looking out for yourself and others. Kind of a mama bear, as Lucy likes to say, looking out for the little cubs all the time. So I think that personal responsibility and personal awareness becomes important. And then the ability to act becomes important. And I'd love to share a picture if I can, Lucy. Can I try?
If you can figure it out, Rob. Just kidding. You should be able to.
No, I should figure it out. I'm clicking here.
Yeah.
I'm sharing going to share my screen, and I want to share a window, and I'm going to click share. And are you seeing?
Nope.
Son of a gun.
There we go.
It took a second. All right.
Yes.
This is an image of the Boston Marathon. And these are 2 people I interviewed. I didn't interview the victim, but I saw him later on CBS Sunday Morning with his prosthetic leg. This gentleman lost his foot. And the gentleman with his shirt off is a graduate student. He's a student. He's not an EMT. The other lady was just someone who was observing. I don't know her profession, but she was observing the marathon. They were in the vicinity. They put on a tourniquet with her scarf, which isn't necessarily the best material because it stretches, and they lifted the leg till help came. They were aware that there was a problem. They cared enough to act as opposed to stand back and just hold their mouth. And they did what they had to do for as long as they had to do. They saved this guy's life. I just wanted to share that image as you talk about personal responsibility or responsibility and caring about your neighbor. You know, I'm going to stop sharing in a second. When I lived in Huntington, Pennsylvania, a little town in the mountains, and surrounded by some of the poorest people I ever met. And I learned that hunting season is year round by some of the folks. So is fishing season because they don't have the money to buy the meat or the protein. And I wasn't so judgmental when I learned that after criticizing someone. But these people with next to nothing, some of the poorest people I ever met, there's wealthy people there too, and all the good stuff, good and bad, rich and poor. But they gave of what little they had. If their neighbor was hungrier, if their neighbor needed a ride more than they did, they'd alter their schedule. People looked out for other people. So that personal awareness and that kindness and caring and being willing to care for your neighbor or even strangers is such an important thing. We try and stress being a force for kindness. That whole thing with the force for health kind of behind my shoulder over here. Protect the gift as the gift of your life. Learn about something, be health literate, apply it to your own life, make your own plan, learn how to stop the bleed, learn any of the other things necessary, and then share it. If something happens, share it. One of the things that got shared, Dr. Franklin, I don't know if you remember this, but when we set up at Joe Brown Park, we built electronic medical records. We put them on that new technology called the CD-ROM and sent people home with those. But we didn't have the medications. And that's where I heard hundreds of people with my little white pill, my blue pill. Oh, I'm on chemo at Charity Hospital, but that was flooded too. And these are drugs. You know who helped? Walgreens. Their pharmacy at the time for their billing, not electronic medical records, for their billing, know that Johnny Jones had these 6 medicines that we're refilling. And then the system was national. And so it wasn't just this Walgreens, which was abandoned and flooded, and this other one that was abandoned and flooded. It was the corporate Walgreens in North Lake, Illinois, stepped up and pulled together. We probably broke a bunch of HIPAA rules, and so don't sue Walgreens, anybody that's an attorney general. But we got that information through a back door. We improvised. We were resilient, and we were ready to act. You know, kind of this, prepare and be resilient now and in the future. It's so important. Make the decision. Even
for the record, that project was called RX Hub, and they did get permission. They did get a one-time exemption to be able to retrieve records and that. But as you're talking, I'm sitting here thinking, it's the individual responsibility and the KISS principle. Keep it simple.
Mm-hmm.
Every third grader in the United States knows how to exit their school building if there's a fire. Mm-hmm. Everybody, they all do. Somehow, when we grow up, we forget that. It's not that hard. We just need to stop and think. Like you say, when you go into a theater, when you sit down in a restaurant, where are the fire exits? Mm-hmm. It's a habit we can pick up, and it's sad that we have to have it, but that's life.
I said to my husband during dinner last night, because I am always looking for my glasses, because I've reached an age that if I don't have access to my glasses, God help us, because I won't be able to see my phone. I won't be able to see anything to help, and so, what do? I go make sure I go to the dollar store and I make sure I've got glasses laid everywhere in my house, so that is my, proactive move to protect myself, to be able to not be paralyzed because I don't have my one set of glasses. Right. And Rob, when you talk about resilient and kind of being bold and kind of being like forward thinking, when you responded out to 9/11, got their lessons learned, right? Yes, the fire department kind of had protocol to take care of those that needed attention, but the police department didn't, right? And you and your
it was so sad because there was a doctor named Dr. Prezant with the fire department. It was and is a brilliant pulmonologist that had all those fire department people screened, including for respiratory, cardiac. And these guys weren't on a fire unless they were in great shape. And then post-disaster, he did a good job. I got involved at 9/11 with the NYPD, not FD. And their medical director, well, he didn't show up after 9/11. I think he was injured but not killed. So there was no medical director. And we set up a clinic at Ground Zero and then eventually at the police academy. No previous medical records, nothing. And the number one risk from the job, was getting shot by a bullet. That was the only prevention and awareness they thought about. We wrote a book about this, but one of the stories in the book, I don't know, chapter 6 or 8 or something. And by the way, I read the book. You can turn it into a podcast. But I interviewed, I just call them Mario and Luigi to make up some names. They're working at Times Square. And while they were working at Times Square, they get a call. Everyone respond to the World Trade Center. And so they looked at each other and said, finally, instead of shoplifters, we get a real disaster to respond to. It was like the highlight of their career after being bored with being a basic cop. They go to the World Trade Center. They see it's on fire. They see firefighters going in. They go in. They go up to about the 10th floor where people were staged to get help coming down. And they both had to assist someone coming down. And when they got down, they got out of the way, the building collapsed. Then they thought, oh my gosh, the second tower is going to collapse. We really got to get in there and get people out. So they had the courage and the guts to act. Can you imagine? It's one thing to go in and the building's not going to fall and you'll be a little bit of a hero. It's another thing to know that the skyscraper could fall and you go back in. So they go back in. Here's the key point of the story is Mario and Luigi. Luigi starts falling behind, but they both get up to the 10th floor. And Mario is carrying someone down. Luigi is guiding someone down. Mario gets out with a person he's carrying. He's in great shape. He's worked out. He's at the gym. He's the coach for his kids' little league team. Well, the building collapsed. Luigi was so slow. Luigi was 30 pounds overweight. Luigi smoked. He was out of shape enough. He died because he was out of shape. His partner was in shape, was quick enough to get out. How well can any of us run away from a fire? When we have to run, hide, or fight in a shooting, are we able to run? I've had surgery. You should watch me walk. I look like Frankenstein. I can't run. I don't think ever again. So I got to learn and be resilient enough to hide or fight, at least get enough upper body strength that if I have to go down a flight of stairs, I can hold on to a railing or whatever it is. But I guess what I'm saying is to be strong enough. Don, what were you going to say?
I see an opportunity, a segue opportunity here too. Talking about the World Trade Center and helping others out. Earlier, Dr. Franklin talked about taking care of her elderly parents. So it was on our agenda. Let's talk about taking care of, being a caregiver, taking care of our elderly parents, taking I'm of an age now where my daughter says you're not allowed to climb a ladder anymore outside.
Mhm.
That's right. And I love the segue because it is, if we say family focused and family centric, right? I loved this quote that Dr. Carmona, confirmed. I knew it all along, right? But, moms are the most underestimated asset in the country today. If you're fortunate enough to kind of be in that position of, leading a family. And even Rob, we saw that as the biggest need when we launched our Africa group in Kenya. They were asking, we need to train the moms to be more,
Well, us medical persons refer to it as Dr. Mom. And the mom knows the symptoms of even the father or the kid. Do I send this kid to school or not? Do I call in sick and stay home? Do I get another babysitter? The dad is so stupid, but it's like, I got this headache and it's the worst one I ever had. And the mom is the one who's doing the screening, deciding, do you stay home? Do you rest? Do you take some Tylenol? Here's a little Benadryl. Let's go to the doctor. Let's do a telemedicine call, or let's call 911. So that's the mom in terms of reaction. But the mom from a prevention side, or the dad, or the teenager, 1 out of 4 seniors over 65 falls and hurts themselves enough to go to an ER every year in America. It's 1 out of 4 of us falls outside on a walk, climbing the ladder, out of a cherry tree, picking cherries. This is bad stuff. And then of every 20 minutes, according to the CDC, someone dies from a fall-related secondary issue, a brain bleed, a broken hip that leads eventually to a bed sore that leads to sepsis and an infection and dies, or a blood clot, or another fall. It's a big deal. So preventing falling is something we all can do in our own homes, whether we're Dr. Teenager, Dr. Mom, Dr. Dad, looking out for 2 levels of falls to be aware of. One is the seniors. We'll get back to that in a second. Another is pediatric falls. Toddlers fall and die. My first patient in my entire life was at Cook County Hospital in Chicago. And I was on the pediatric service, and a child had rolled over on a bed in a tiny bedroom. The bed was next to an open window without a window screen. And the child, 18 months, rolled out of bed, hit their head, and died in my hands. Was me and the neurosurgeon. My first patient ever, my first surgery ever. But as soon as they went to do the burr hole, there was so much pressure, I won't get into the details, but the child instantly died to try and relieve the pressure. It was just too much. The point is, kids fall. They fall between railings. They fall off the deck. They fall off a bicycle. They fall off a horse. But the senior fall, preventing seniors from falling, is something we can be very proactive about. We have a checklist. I could share my screen and show it to you, or we can just talk about it. But it's checking for things like, are there loose rugs? Oh, here you go. Where for children, these are good examples. Simple tripping. Are the floors wet? Is there a mat in the bathtub? Are there, that IKEA furniture or other heavy, tall dressers? No offense, IKEA. IKEA furniture comes with a clamp to screw it to the wall, and no one ever does it. But all I have to do is open a drawer and try and climb up like a toddler holding on to something 20 inches tall. That little bit with the drawer out is like a lever that pulls the dresser down on them, and they die, or they have a significant injury. So something as easy as securing, in part 3 here, securing a piece of heavy furniture against the wall, something nobody ever does. But so there's checklists for children, and then we put together a comprehensive checklist for the home that involves both peds and the adults. Railings, grab bars. When I left Mayo Clinic after a 10-hour back surgery, my back was fused. They didn't let me go home until I had plans in place to have grab bars put, have an additional railing put, and frankly, at that point, also a stair climber. Because they knew all their handiwork would be shot if I fell before my spine was fused, or if I broke my hip. I'd be so incapacitated, I'd probably be one of those people that died. It's so important to put together not just your plan for the major disaster, the regional flood, hurricane, fire, but the personal disaster where grandpa or junior might fall and be injured. And then so there's prevention, and then there's also the first aid of what to do or not to do is part of the preparation as well. Dr. Franklin, did you want to say something there? I saw you raise your hand. Show me.
See this? You know what this is?
I see a telephone.
It's a cell phone.
Yes,
You
ma'am.
know what this is?
That's your lanyard to always have it with you.
That's my lanyard. So my phone is my daily jewelry.
Mm-hmm.
I'm a single elderly person. I don't mind telling you, I'm 70 years old. Having an Apple Watch or some kind of watch that can communicate is one thing. This is also another thing. It may not be that pretty, but when it's all powered up, you can contact anybody that is connected to your phone plan. You can dial 911. You can look at a plan, the PDF plan that we talked about, Rob, that you talked about. Mm-hmm. You can actually put that on your phone because your phone's programming has an amazing array of software to provide various support. Yeah. You can also do something. Rob taught me how to dictate on my phone. So you can write all kinds of notes. My medical records can be accessed through my phone. My medical records are on my phone. Okay. Yeah. So back when there was Katrina and the cell service was screwed up, we also did not have these things called smartphones. We had flip phones, and flip phones were essentially useless except to do text messaging.
Yeah. You know, what we had on the phone also was an ICE. I know ICE is not necessarily the term people would use today, but it is in case of emergency contact. And a lot of EMTs are trained to pick up your phone, especially if it's unlocked. And that's why it's important to unlock it with your face, because if you don't have the password, no one's getting into that phone to find that medical record. But in case of emergency, they might look if someone's listed as your ICE. It's your immediate contact, your medical power of attorney. The other thing is I've been learning, I'm having so much fun. I learn every day, especially from other patients or teenagers. But some of the phones, I know the Apple Watch has it, but some of the phones, both Apple and Droid, have accelerometers in them that if you fall quickly and stop abruptly, it knows you fell, it turns on your phone. If you give it permission, it shows your location and it calls 911, even if you're unconscious at the bottom of the stairs or on the trail in the woods.
Or in a car accident.
Yeah.
Well, we go to then the concept then of, really, do people know that? So part of the Fit Family Force, right? And when we really look at Fit Family Force and getting folks prepared, we are looking kind of at that Gen X parent. Of course, any teens that want to come up and be that kind of, trained ambassador within the family to make sure mom and dad are connected, to make sure that we're walking through grandma's house, to make sure that there's not curled up rugs. I have actually done this with some clients of mine, entered in emergency contacts, right, for them in case they do fall. And they will go ahead and be notified. So, of course, the phone is a beautiful, beautiful tool, but we have to be, aware of that last inch, Rob likes to call it. You got the last mile, but the last inch is, the digital health literacy of our families. The one thing that I was going to mention, because I do think all of you guys, all three of you said when I wanted to throw in fall prevention, right, into this thing. All three of you were like, well, that seems like kind of out of nowhere. What does that have to do with disaster recovery planning? It's a little disjointed. And I said, listen, and Don, you were reminding me when we met earlier about this kind of new modified definition of disaster, right? Disaster occurs when the resources to address those, the disaster itself, are stretched or limited or gone, right? So yes, we can talk about hurricanes. Yes, we can talk about possible, cyber attacks. But as a mom, if like, again, my client, my 85-year-old client, and she had means, right? But when she fell, because she's trying to stay at home and live and not bother anybody, even with means, we found ourselves needing to step in and help. My husband knows her very well, and so just being able to go in there and prepare, that then creates a disaster if time and money are the resources of the family, and grandma falls and now she can't be by herself. Now the kids are going to have to get in there to visit, perhaps spend money to have a caregiver there. So I see that as a little mini disaster that perhaps can be prepared. And as we look just really quickly, because I think that this is super, super important that this gets across, let me share the screen because it's super important. And I just want to share. I'm on many, where are you? Darn it. I will find it. I wanted to make this point. I am on many statewide task force that are looking to grow the healthcare workforce and to reduce costs for the payer providers. And the statistics that are involved with falls is incredible. I mean, the percentage of, if you fall and you're 65 years older, right, the likelihood for that to then turn into almost a mortality related issue is significant. That puts a stress on the first responders, et cetera. So that's why my call to action is, come on, families, let's get our teens and let's get our youngins and let's check on the seniors in our lives, so that we can do everything that we can to prevent.
And I think after the fall, Lucy, or after the injury, is a part of the Dr. Mom thing. I'm just going to share a screen to make a point. And we'll see if it shares. But we've put together, it's one thing that Dr. Franklin suggested. It's at the bottom in the waiting room on the very left, Lucy. We put together something called My Healthy Digital Navigator training. And the goal of this is to learn skills. There's a series of them, but once someone is ill and once someone is in trouble, the follow-up. It's one thing to have a phone. It's one thing to have a smartphone, an iPad. My 100-year-old mother has an iPad and a smartphone. She never mastered the iPad, but boy, she's good on the phone. But the point I'm getting at is some aren't. So if you have the digital skills to go in and help set up, let's say Vangie's got a new phone, show her how to program the accessibility thing so she can read it, so she can dictate into it and send a text message, even if her hands aren't working, even if she can't see the screen, to how to set up and use that portable blood pressure scale, pulse oximeter, home IV, home dialysis, whatever's going on at home, someone who can help, be it a teenager to say, all right, I'm going to help set up this FaceTime call. The telemedicine visit's going to happen with the nephrologist or the psychologist, and be able to make a home visit happen and be able to be technologically astute enough to help someone communicate with their doctor, with their medical portal. So that's where the digital navigator training is something I feel very strongly about, because I think any teenager, middle school on up through senior citizen, that's a course they ought to take. So if we have one person like that in every family or in every little neighborhood cluster, that can make such a difference in the quality and cost of someone's healthcare.
Yeah, the hypothesis we're actually trying to prove is that a certified ambassador, perhaps through Force for Health, but at least, or somewhere else, but what we're offering up is the hypothesis that at least one trained ambassador that knows these basics can help reduce cost for not only themselves, but then for their families. I throw this just up on this in terms of the numbers. Now, I'm very proud of our state, Arizona, that they actually track this type of fall prevention and fall related statistics. I'd be curious, as part of the Reality Health Games and part of this competition that we're trying to engage here is like, hey, how does your state do this? How does your community do this? And who are the partners around the table? So special shout out to the Arizona Falls Prevention Coalition for having these deals. We even went ahead and added 2 videos over at the Academy on their behalf so that in 2 minutes, you can truly see what the impact is and what you could potentially prevent if you just cared about. My dad's 80 years old, thank God he walks daily. In fact, my mission in life is to beat him on average step count on his phone, right? I'm like, I can't believe that my mission in life is to be physically more active than my 80-year-old dad. But another significant user on the network is a grandma, auntie, great auntie that was helped to connect to the systems by her 16-year-old and 18-year-old grandkids. And once she was connected, she's off and running. She got to brag to her whole family that she finished our virtual 54-mile walk challenge before anybody else did. She did it in I think 5 days, right? She was out and running. So the ability to connect our vulnerable family members to the apps. I was talking about Red Cross earlier. I personally think that every single family member should have the Red Cross app downloaded so that if there's a disaster happening in their neighborhood, they're getting notification. We never have hurricanes or tornadoes, but we actually had 3 tornadoes touch down 6 months ago. And that was the kind of first, we always get extreme heat warnings, right? Death in Arizona. But Red Cross, we love you. And we highly recommend that everybody download the Red Cross.
I'll take another issue along those lines. Everyone, has got some old person they know, like me. All right.
Yeah, Rob, we know you.
Yeah, and so what we're talking about, I'm agreeing with. The statistic Lucy showed, 89% of the deaths from falls were with people my age and older. Okay, so if you know an older person, get our checklist and do a fall prevention. But another issue, Lucy, is you're a real fan of certain apps on the phone. One of the things I'm concerned about, and I'll use myself as an example, is sickle cell disease. I'm a white guy who trained in Minnesota at the Mayo Clinic, went into practice in Lancaster, Pennsylvania, where the Amish of Germanic descent were the predominant population. And I had one patient in my life with sickle cell disease. One. It was a tourist who wanted to see the Amish. Okay. And he got sick and he had an episode, a crisis that gave him, it was an acute chest syndrome. He ended up on a ventilator. And then, so I see him in the ICU. I don't know anything about sickle cell. I had one paragraph of training about it, maybe in medical school, maybe one question on my certifying exam. Our 360 SCD Hub app that we made with the sickle cell, Arizona is wonderful. The Sickle Cell Disease Association of Arizona made an app. Actually, we made an app with them that's free to the world. And if you have an illness that other people don't understand and you're traveling, those, anyone watching this, those QR codes maybe, or here you go, can be a way to do it. But the point I'm making is part of it is educate the patient, but a big part of the app is how can you educate the professionals that are taking care of you? Your football coach, your teacher. If you have hemophilia, if you have sickle cell, if you're getting chemotherapy, if you're on certain specialty medications that no one's ever heard of. That's all. If you have a condition, be able and be prepared.
Yes.
I learned how to use an insulin pump. I'm just being modest. I am so ignorant. As a well-trained doctor, I'm one of the best trained people in the country. I am. I've had the privilege, call it white privilege or call it hard work privilege, I don't care. But I've had the privilege of going to some of the best institutions, working with the smartest minds. And yet, it was on a sleepover camp for my 5th grader where I got put in a cabin with all the sick kids as the doctor dad. And a 5th grader came over to me and said, do you know how to manage my insulin pump in case it gets too high or too low? I had never seen an insulin pump before in my life. This 5th grader spent 20 minutes teaching me about low blood sugar, high blood sugar, how his pump worked, how to give an extra glucose or how to give him the glucagon if it was too low. A 5th grader taught me. So I want us all to be modest, that we can be taught by others and be receptive to it, especially doctors that are watching. You go to some other site or someone comes into your ER, if you don't know the condition, yeah, you can do Dr. Google or PubMed, but that patient may have information. And if you're that patient, print it up and have it ready to hand off. Doctor, you may not have seen someone with this condition. Hell, I watch commercials on TV. I'm learning about conditions I never heard of. Now that I'm retired, it's amazing.
In my experience, the worst thing that I had to deal with as a director of urgent cares in Ohio was people who had chest pain during the summer. Usually they were visiting somebody, so they did not have a medical record that could be accessed easily. And nobody seems to have, I mean, I don't know who has a completely normal EKG, but to be confronted with somebody, and we're talking 20 years ago too, and this was before you could do a blood test to determine if somebody was having a heart attack. Having an EKG, you know, I would print up the EKG and give them a copy of the EKG, baseline EKG, to those people who I discharged. And I told them to fold it up and put them in their wallet. Well, now they can put it on their phone.
Yeah.
They can take
on your patient portal. It's critically important. And if someone doesn't understand,
or take a picture on your phone and put it in your phone's, whatever, you know, wherever you think you should put it, in notes. In notes, I have my entire life in notes. In my computer, I have everything I would ever want on my computer.
That's a good point. And I think I do that as a lung doctor, chest x-ray. Our first question when someone comes in, oh, I'm here because my family doctor found a nodule on my lung. And if that nodule was there 20 years ago and hasn't changed, you say, it's nice to meet you, goodbye, don't worry about it. But if it's changed, it's a whole nother thing. It could be a lung cancer. And so having a copy of an old x-ray, an old electrocardiogram, that little squiggle, if that squiggle has changed a certain way, it's a heart attack. If it's been that way for 20 years, it's just a squiggle.
It's not.
And so it's kind of like lending a friend a car. When they drove the car and they return it to you and there's a big dent in the door, was it there before or after you rented the car or lent the car? And that historic information is crucial. Don, you're going to say something. No?
My experience with Katrina was a watershed event in this country to nationalize digital information for individuals. The electronic medical record did not have any traction before that. After Katrina, it just took off. Yeah. And to have an electronic medical record, access to it, is one of the key things that doctors are now looking for in order to assess patients properly and provide the appropriate care. Phone connections. They've come up with different routing for cell phones so that there is redundancy, so that if a tower gets blown away, you will still be able to use your telephone. Financial records, like I told you, I could not get into my bank account when I was in Dallas, and this is right after being evacuated. So I had no money I had no money. See, so being aware of situational awareness not only includes whether or not you have increased risk, but situational awareness can provide you with support if you have a problem. And that's part of what's in the tool.
I think I'm failing on my timekeeping clocks. We can assume that there's just so much more to talk about. But as we round up here, right, and as we kind of remind folks it's preparedness. Hey, way to bring in Sickle Cell Awareness Month, right, Rob? Good job. So, September is Preparedness Month. September is Sickle Cell Awareness Month.
Fall prevention month.
Fall prevention month. September is Healthy Aging Month. Aging is dependent on how well you prepare and minimize the risks that can potentially affect your ability to age, right? I mean, I feel like I'm a mini senior. So I'm trying to look and see what I can do for myself to make sure that I am as robust a senior as possible. So let's go around the ring really quickly. You each have 1 minute for final comments on this lessons learned in preparedness and fall prevention call out to everybody. I'm going to start with you, Dr. Franklin.
I hope that we have provided you with a platter full of options for how to address the challenge of being in a disaster, be it something that is small or be it a wildfire, something that's huge, okay? But there are tools that are out there that will make your stress in that situation much less and give you the resilience to approach whatever issues that you might be faced with because of whatever it is that has caused that disaster that you were in front of.
Yeah, perfect. Know your tools, right? Don.
I could not add anything better than what Dr. Franklin just said. Know your tools, use your tools, and nobody expects a disaster. That's what makes it a disaster. It can happen to any one of us or all of us. So
that's right. That's right. Nobody cares about disaster emergency medicine.
Nobody needs disaster medicine until you do.
That's right. Okay, Rob.
I think in ordinary times, learn how to use all the gadgets and all the tools so that in extraordinary times, you can act, and don't be afraid to act. But it's the fear of acting, kind of what Dr. Franklin just said. If you have a good understanding of your tools and some additional knowledge, learn it, live it, and share it. That platter that Dr. Franklin's referring to, I've been spending the last 20 years trying to capture, and with the last 7 years with Lucy, making it accessible and interesting, because I have learned the most about disasters from people like Dr. Carmona, Donahue, Evangeline Franklin, and also the victims themselves taught me a lot. Not everyone is lucky enough to, like me, to learn from people like this. And that's why we're trying to put this expertise together, this video, this series, and the tools at the Force for Health Academy. They're free to get started. These are real health issues. And that's why we call it the Reality Health Community Challenge. Take care of the real health issues. Work on them before, during, and after.
And I guess my closing thoughts really are, reminding ourselves that even if you're not feeling like you're in that disaster medicine or preparedness type of role professionally, that, as a mom, I just want to know how best to protect and care for my family. And I know for a fact in just my conversations that I know others are looking and seeking to do the same. So that is my call to action is mamas and papas and invested teens. if you're looking for a way to lean into purpose, protecting that force field around your family could be a really great focus point for the fall. Okay. In the spring, we'll worry about we, but now it's about me. So let's make sure that I am prepared and those who are closest to me are protected. Okay, so that's my call to action for September Preparedness Month. Thanks so much for joining, everybody. Of course, this will be on our YouTube channel and remain on our LinkedIn and Facebook for a review later. And then we will be doing some pull-out quotes and some replay motivation badges, so stay tuned. But go to theforceforhealth.com. You can sign up for free, get started. If you're in the App Store, go ahead and search for 360 Force for Health Academy. The 360 Force for Health Academy is our free app to get started. We do have a Force for Health virtual wellness club and a Force for Health coaching and a Force for Health food club. Those are kind of all within the ambassador realm, all for $49 a year, of course, not $49 a month. $4 a month, $49 a year, you would have access to all of these tools in there. So Dr. Franklin, is an honor to finally get to meet you. I've heard Rob talk about you for years. Dr. Donahue, thank you for representing WADEM in the way that you do. And thank you for your passion to want to go ahead and you train these professionals, you host a biannual, Congress and summit where 1,600 professionals representing 80 different countries come together, and you talk about best practices and how best to learn from each other. And so we're just now taking that expertise and delivering it into grass action roots with the leaders and the family.
Just like Vanjie's, just like Dr. Franklin's first slide, those interconnecting things. We're trying with the family and the communities. Dr. Franklin is dealing in a larger sense with the bigger communities and regions. Dr. Donahue is taking all that and having those things match up for a connected world. We're all in this together. We all have to look out for each other.
And we will see you next month or over at the Force for Health Network. So thanks for joining, everybody.